Give an example of conflict at work. How do you answer this question in the medical interview? Well, watch this video and find out. Hi, I'm Anthony, the Career Doctor. I make videos for other doctors to help with career challenges, things like the job application process. At the moment, we're concentrating on interviews. So, one of the most favourite questions for panels to ask medical trainees or other doctors at interviews is around the issue of conflict at work. There are a number of reasons why this is the case, but clearly one of the key selection criteria for working in a healthcare environment is how you work as a member of a team and how you resolve differences or difficulties with other team members. So being able to deal successfully with conflict when it arises in the work environment is really a key capability that you need as a doctor in order to both succeed and survive really in the health context. So it's a favourite question for panels to ask about, and it's usually implied in at least one or two selection criteria in the job, particularly around things like communication and collaboration. So the thing is, a number of trainees are worried about this question because they're worried that maybe the example they have is not a great one, or perhaps they're just not sure how to tell the story about resolving conflict. Some people probably are more fortunate in having less conflict situations than others, but the thing is, it happens on a regular basis, and as panel members, we really don't believe a trainee if they say that they've absolutely not been involved in any sort of situation of conflict in the past. So trainees worry about the type of examples that they give to this question and how to really successfully sell their skills in terms of resolving conflict in the work environment. So I wanted to put a few tips together for you in order to show you how you might go about approaching this question, which, as I said, is one of the more common questions that can arise in the medical interview. So the first thing I want you to remember when you get a question like this around conflict, or it might come in another guise around difficulty in, say, in communication or challenges working in a team, that sort of stuff, is at the end of the day, when we're looking at medical jobs, particularly ones where we're putting you in an employment role, despite all the official selection criteria, I guess, the one thing that most panel members are thinking about in the back of their mind is, will this candidate be a good team worker? Will they be a happy team worker? Or flipping it, is there any sense that I have that this person might create problems in the team? And if so, they're likely to rate you down significantly if they feel that you might create a problem in terms of team dynamics. So it's something that we're all sort of sensing for and looking for, that we want to see that this person can contribute to the team, hopefully in a very positive way, perhaps reduce the workload of other team members by having certain strengths and ability to get on, but at least fitting well into that team and not contributing to additional problems. So again, this is a reason why we ask for examples of conflict rather than asking the candidates how they might deal with conflict. This is a perfect scenario for asking a past behavioural question. And if you're not sure what one of those are, go view one of the recent videos I've given around how do you give examples in the interview situation. I'll drop a link to that below this video description. So being a good team member is a key thing that you want to demonstrate to the panel in the interview. And if this question comes up, you want to try and succeed at it in order to demonstrate that. So some key points here. Firstly, conflict questions are almost always put as a request for an example of a past situation where there's been an issue of conflict. As such, though, the STAR technique, which I've described in previous videos, is a very useful approach to how you tell the story around the example of the conflict situation that you want to give to the panel. As ever, as always, within the STAR framework, the result is really the key part of the example. You do have to give the situation, the task, and the actions that you took, but if you miss out the result, if you don't tell the panel what the results of your actions were, then you really haven't sold yourself in terms of someone who can deal effectively with conflict in the workplace. So remember the result. And as I said, panels just won't believe you if you say you've never had a conflict. I've had that situation on a panel. We just think, well, if you haven't ever had a conflict at work, then maybe you're not being paying enough attention. Maybe you're actually an isolated team member or someone who walks past conflict or something like that. Because it does happen. There's lots of differing views and opinions and perspectives. Humans in suffering situations and often lives at stake, things can get tense, and so conflict does arise in the health and hospital setting. As I also say, sometimes this question now, because people are kind of expecting it, might come in a slightly different format, like challenges in communication, for example, or having to deal with someone who is underperforming, something like that. So, what types of conflict are there actually that you can talk about when you are asked to give an example? So, the first thing most people think about when asked for an example of conflict is a conflict with another colleague, another worker. So you might think about, how you got into a conflict situation, say with a member of the nursing staff or perhaps a fellow trainee doctor, that sort of thing. And that's perfectly fine if you've got an example of that, but sometimes people worry about those examples or don't feel that their example's good enough, and they sort of walk past other potential examples. If you're asked for work conflict, it could actually be a conflict between you and a patient or a family member. So don't forget that those sort of situations also arise in terms of conflict, and that might give you a better example or a safer example to talk about. And also, it doesn't necessarily need to be you at the center of the conflict. It could be an example of how you've helped resolve conflicts between other parties. And again, that might actually be a much better example and a safer one to give to the panel. So think about those other types of conflict when you're thinking about the examples that you might give to the interview panel. Now, there's certain conflict examples that I recommend that you should avoid if possible. I say if possible because sometimes they ask for specific examples, like they might say an example of conflict with another colleague at work. Well, of course, that then excludes patients and you resolving conflict between two other parties. But there are particular situations I think you should try and avoid unless they're asking you specifically. Firstly, don't give a conflict example where you can't give the result. A situation where the conflict remained unresolved. That shows you in a poor light, and it's not going to come off successfully with the panel in terms of how they rate you for that question. So try and pick a conflict where you were able to successfully deal with the conflict and move on in a healthy manner. And we'll talk about what that might look like in a minute. Secondly, unless you're specifically asked for this, and it is starting to happen, by the way, particularly I've seen in some of the surgical interviews they ask for this particular instance, I would recommend avoiding giving an example where you were in conflict with a more senior colleague. Now, why is that the case? Well, look, I just want to be completely clear here. I'm not saying that trainee doctors should not speak up when it's required with more senior staff. So I'm saying you should definitely speak up where it's important for things like patient care or other doctors' well-being or the civility of the workplace. The conflicts with senior colleagues will happen, and you need to be able to deal with that. But I just think at the interview, as I say, unless you specifically ask, for example, for conflict with a senior colleague, it's a bit risky giving such an example when other candidates may be giving more safer examples. Because remember, most of the people sitting on the other side of the table, the interview, are senior people, and as much as we want to put bias away, your example might generate in certain people's minds the idea that this is a trainee doctor that likes to engage in conflict with senior staff, and that might make them a little bit uncomfortable. Now, I'm not being hard and fast about this. You might have a really good example that you think sells your ability to resolve conflict well. That's okay if it's with a senior colleague, but I would recommend in most cases, as I say, come up with something different, unless you're specifically asked for such a situation, and in which case everyone's being asked for the same thing, so you're on a level footing. So just avoid those two situations if possible. What you should talk about in terms of your conflict example, and remember we've talked about the STAR technique, so you obviously need to give the situation, the task, the action, and the result. But more specifically, things that you should remember to talk about within that are, firstly, how you manage the communication with the other person. How did you listen to them? How did you try and obtain the other person's point of view or perspective? Did you demonstrate respect for their point of view? Often the examples you're giving are usually where you might have, say, been in the right about something, but the other person had a valid point. So you want to show that you've actually acknowledged that, but help them to see that perhaps your perspective might have been the better one. Occasionally it might be a situation where you were humble enough to see that the other person was actually in the right. So you really want to show that you respect the other human beings in this scenario. So talk a lot about how you, say, for example, took the person aside privately had a safe discussion with them, really listened to them, understood where they were coming from, that sort of stuff. Secondly, I think it's very healthy to try and emphasize that patient care was always central to the discussion. It inevitably generally is, but that may be the way that you sort of got everyone involved in the conflict situation to sort of come together and look at each other's perspectives and resolve the issue. So I recommend if that fits with this scenario that you've got, that you talk about how you used the rationale of patient care to keep everyone together resolving the conflict, and that's usually a good tactic for what we call depersonalizing the conflict. If you can externalize it to something else important that everyone can agree with us in terms of a value such as patient care, that's usually a good way of resolving conflict. You of course need to talk about how you've used other people in resolving the conflict situation. As a trainee doctor, we don't expect you to manage everything on your own. Usually there's some sort of supervisor or director of training or mentor around. But again, be careful about how you do that. You want to use an example where you've actually made an effort to resolve the conflict initially with the other party and showed good communication and team member skills, but then maybe you've had to then seek some advice from another colleague. Maybe you've had to escalate, but you've done that in a respectful way. Don't forget, sometimes conflict situations create tensions for us and may affect our own well-being. So did you go and talk to your mentor about what was going on? Did you actually get some feedback on your own approach to resolving the conflict so that you can be a better communicator and conflict resolver in the future? And I think this is essential, this last point, to a successful example of conflict resolution. Are you able to authentically say that after dealing with all that conflict, that there was a good relationship afterwards? If it was with a colleague, were you able to work with them in a professional way and still get on, maybe even share a laugh afterwards? If it was with a patient or family member, did they come back to you later on and say thank you for listening to us and respecting our perspective? Did it help their journey? If it was you resolving conflict between other people, did they come back to you later and thank you for your efforts? And did you see harmony going on in terms of what you'd done with them down the track? So yeah, if you aren't able to say that, and you should always be genuine about the examples that you give, then again, maybe it's not a great example of how you manage conflict in the workplace. As I say, remember, being a good team worker is probably the #1 selection criteria in a panel member's mind. So you really do need to think going into the interview, what is going to be my example of conflict resolution? Is it a good one? Can I tell the story in a successful way to the panel that gives them the idea that I really do value teamwork and I recognise that conflict does exist and it needs to be addressed in the workplace? That example that you have is probably going to be useful for a range of other scenarios that might come up. So it's worth working through what that is now before you go into the interview. So that's how you deal with giving an example of a conflict at work. If you've been finding these videos useful, we'd really encourage you to subscribe, turn on notifications, and leave a like for the video. Also tell your friends. Do you have any questions about the interview process, in particular examples of work conflict? Maybe you have an example that you're not sure whether it would be good to use at the interview. If so, you can leave a comment below as a question or just a comment, and I'll engage with you and provide some suggestions around that. Thank you for watching and see you next time.